A beautiful smile is all that we want, but problems like decay and cavities can threaten teeth and ruin your smile. When does the need for root canal arise? The journey begins when your tooth starts getting a cavity, which probably we can't even see. Why does your tooth get cavity? Our body is full of bacteria, good and bad. Similarly, our mouth also has bacteria. Cavities occur when the pH balance of your mouth is disturbed and bad bacteria start to grow in the acidic environment of your mouth. Do you know why we blame sugar for cavities and decay? That's because bad bacteria feed on sugar. Same bacterial colonies are also present in your vagina. Some women will suffer from UTIs while others will witness white discharge. Now, let us understand acidic foods. Coffee, chai, soft drinks, caffeine, all these are acidic in nature and destroy the pH level of your mouth. The topmost layer of our teeth is called enamel. It is a protective layer that begins to tarnish in an acidic environment, and your tooth starts to lose minerals, which causes decay. We didn't take care of it and it kept on causing further problem. Soon this cavity spreads towards the roots and makes them hollow. Here lies a canal. Dentists clean that canal with instruments and remove the infected part. Then it is filled with tooth filling, and if the crown is fully damaged, they put a bridge or a cap on it. And again, tooth starts to function well. But you know what? Root canals are dangerous sources of toxicity and infections. Researchers found that when a dentist does a root canal procedure, there are some bacteria left. It is never 100% disinfected. It is also found that this infection will grow in an anaerobic environment, that is, in the absence of oxygen. As time passes, cavities start to spread to the other teeth. This is called an interproximal effect. Now, you may ask me, Palak, if I have a cavity in my tooth, then why is it not paining? Why there are no inflammations or swollen gums? You can't feel any inflammation because the nerve ending is destroyed when root canal is done. Blood is supplied through that nerve, but if the ending is dead, you will not feel any sensation. Infection is present there and is spreading. It's just that you can't sense it. Dr. Edward Millanby, you can research about him. He's a very famous dentist. He says visible teeth have roots beneath them, and these roots are connected to the main canal. When your dentist operates on the root canal, the nerve endings of that tooth are restricted from the blood flow. Ultimately, the roots are dead. After the procedure, there are some spaces left. In these spaces, the bad bacteria grows and progresses towards the side canal, which may cause chronic inflammation and infection. Let's say you witness a small dot on your tooth. That's an alarm sign that the bacterial colony in your mouth is changing. Bad bacterial colony is growing and there is a possibility that it causes bad breath. Now, if you get this problem, what are you supposed to do? The first thing, oil pulling. You take extra virgin cold pressed coconut oil, put it in your mouth, swirl it for 10 minutes and spit it out. Oil pulling will kill bad bacteria present in your mouth. The second thing is to add alkaline foods to your diet. If you drink coffee, then make sure to drink green juice also. If you drink soda, take lemonade also. Add fermented food to your diet so that good bacteria colonies can grow. Somehow, if the tooth decay is irreversible, please pull the tooth. But never go for a root canal procedure. The other thing is, if you're told to get a bridge on the crown, then make sure it is a removable bridge. Removable bridge is different from your traditional bridge. In traditional bridges, they grind two adjoining teeth also. This affects the other two healthy teeth also. What is the need to destroy them? There is a possibility that after 7 to 8 years, you will have to get root canal done for those teeth also. But the removable bridge will start to get off after 2 to 3 years. But it's okay. Think about long-term and not short-term comfort. Or the best solution is to get a new tooth. Third thing is to massage your gums every day. Another tip is to keep a clove bud in your mouth whenever your gum swells unexpectedly. Clove is antibacterial, or try oil pulling, which is also antibacterial. And the last thing is neem. Brush with neem. Vitamin D and K2, you'll get this in Palak Notes ADK. Start taking ADK because the calcium that we take has no idea where it has to reach. Calcium's transportation and absorption are done by vitamin D and K2 together. Just like any other organ, your tooth can also regenerate, but only if you take these preventive measures.